Welcome back to Fresh Living. We're talking about why it's important to understand your cholesterol. We have Dr. Brent Muhlstein here with Intermountain Medical Center Heart Institute. And you guys specialize in this kind of stuff. We're actually having an infothon today, so you can call the number on your screen. It's 877-908-0680 if you have any questions. But first of all, Dr. Muhlstein, tell us what we need to know about cholesterol.
Cholesterol is one of the major components of atherosclerosis, which is the plaque that builds up in your arteries, especially in your heart, but in any part of your body, and can cause it to block, and then you don't get the blood flow that you need, and that can cause the heart muscle to die, which is a heart attack.
All right, so there's good cholesterol, there's bad cholesterol. What do you need to know about each?
Yeah, the bad cholesterol is the kind of cholesterol that goes from the blood into the plaque, and then some of the cholesterol can be sucked back out of the plaque by the body, and that goes through the good cholesterol. So the good cholesterol is HDL.
Okay, that HDL is good.
And the bad cholesterol is LDL.
Now, what you're probably going to tell us now is that the way you eat and whether you exercise will contribute to these, right?
Yes, I am.
All right, so what can you do? So say I go in, you know, I used to think cholesterol, that was just for old people. That's when you had to start worrying about that. Then my doctor last year said, you need to have your cholesterol tested. So I guess, you know, we all get there. And what do we do if we have high cholesterol?
So if you have high cholesterol, you can try exercise and diet and so forth. Make sure you're not overweight. Lose weight if you are. And then also exercise increases the HDL, the good cholesterol, so that's a good thing to do.
Is it hereditary?
Oftentimes it is hereditary. And
do you find some people who look like they're really healthy and then surprisingly they have high cholesterol?
Yes, cholesterol can be high even if you're not overweight in the standard sort of a unhealthy person, and therefore you have to look out for it. And so you should check it. Get your blood tested and check to see what your cholesterol is.
You know, we would always see those Quaker Oats commercials, like, this lowered my cholesterol. Does that really do that?
Quaker Oats has been shown in some studies to raise the HDL cholesterol just a little bit. But you also have to remember that 85% of the cholesterol in your body is manufactured by the body. And you can only have a modest effect with exercise and diet. And so there are many patients who need to take medicines. And we have very effective medicines. Some people have side effects with some of them, but most people can tolerate them well. And so talk to your doctor, and if he prescribes a medicine, it's probably all right to try it.
Probably all right to try it. All right. And then will we have symptoms if we have high cholesterol? Will we feel tired? Will we feel run down? Or is this one of those you don't know until you have it checked?
Yeah, it's one of those you don't know until you have it checked. The major problem is that the cholesterol plaque builds up in the artery, but until it becomes severely blocked and restricts blood flow, you can be feeling fine. You can go running marathons and everything. But then if that plaque ruptures, once it ruptures, then suddenly a blood clot forms, and then the artery completely blocks.
Then you have a big problem.
And then you have a big problem instantly that you never would have guessed.
Right.
And so you have to do things when you're asymptomatic to check and make sure you're all right, and do things so that it'll never happen.
Okay. It's not no news, it's good news. You got to stay on top of it. Ignorance isn't bliss. Thank you, Dr. Muhlstein. And again, you can call that number on your screen if you have any questions. Now,